Infant CPR. So this is never a nice thing to do, and it's never a comfortable thing to do, but it's something we definitely need to talk about. So an infant is from birth to 1 year old. CPR is done in a similar way to adults, but obviously because they're so much smaller, things change a little bit. So you're still going to do your hazards, hello, help. You're still going to be checking for breathing in between the hazards and the help part, and you are still going to start with compressions and then airway and breathing. The compressions in an adult is 100 to 120 a minute. It's the same rate for an infant. For an adult, you're going to push 5 centimeters deep or down on their chest. On an infant, you're going to push 4 centimeters. So it's not a very big difference. You must realize that this is nearly half of the diameter from their chest bone to their spine. So it's quite a distance in an infant. And you're going to push in the same place. So you're going to push at the bottom half of the sternum. But instead of using your palm, you're going to be using your fingers. So it is important to realize that this is going to be quite different, but you're going to push hard and you're going to push fast, and you're going to allow for proper chest recoil. So you're going to allow the chest of the patient to come up properly, and then you're going to let it go down properly and up properly, allowing the heart to fill between each breath, or between each compression rather. So when do you do CPR on an infant? So if they are not showing any signs of life, if there's no breathing and no movement, they probably have no pulse. It's very difficult to feel a pulse on an infant, but if they're not breathing and they're not moving and they're not responding to you, so, if you try to wake them, or if you flick them at the bottom of their foot, this is something that normally stimulates them quite a lot, and they're still not moving, they're still not waking up, you can quite safely start CPR. When it comes to the airway and breathing part of a child, you must realize that their lungs are very small and their mouth and their nose are very small. So with an infant, what you do is you lie them on their back, you tilt their head back a little bit, and you put your mouth right over their nose and their mouth, and you give a little breath. Kind of like when you blow out a candle, that kind of breath. And you must realize that when you do breathe, the way you know you're giving enough air is that you see the chest go up and you see the chest come down. If you see the chest rise, that is enough air that you're giving. So you would do 30 compressions and 2 breaths, 30 compressions and 2 breaths, which is the same as an adult. So it is stressful, but it is definitely going to make a difference, and it's potentially going to save a child or your child's life. And I would definitely recommend that all parents and all people who are taking care of children are very familiar with this. So here's a video on how to do that.
My scene is safe. I'm wearing gloves. Baby, baby, can you hear me? Baby, baby, can you hear me? Help! Somebody please help me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There's no breathing. Please, can you call for backup and bring an AED? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 27, 28, 29, 30.
Once you've started CPR, you must continue to do CPR. You must make sure that help is on the way. So you phone whatever emergency number you have in your country. And yeah, I hope this was helpful. I hope you guys learned something. If you watch the adult CPR and then this CPR, it'll be a good refresher. And remember that there is a quiz at the bottom that will help you solidify what you've learned here, and hopefully help you better grow and have a better understanding of what's been said. Hope this is helpful. If you enjoyed it, please hit the like button and subscribe. It really helps me. If you'd like to see more of this, I will be doing my best to get out more videos on more relevant topics. And if there's any topics that you guys would like me to do, just drop a comment and I'll see what I can do. Cheers for now.